Are you ready, Chris? Good morning. We will start quickly. My name is Kim McCarl. I'm the Communications Officer for Contra Costa Health Services. We are going to do two short statements, and then we will take questions, and then we have Spanish to do the same statement, and we'll take questions as well if you like that. We have with us today Contra Costa Health Officer Chris Farnetano, and then we have the Chair of the Board of Supervisor, Candace Anderson, and then we have Rohan Radhakrishna, who will do the Spanish. So I'm going to turn it over to Chris, and then we will circle through the three and go from there.
Thank you, Kim. I am Dr. Chris Farnetano, CHRISFARNITANO. I am the Health Officer for Contra Costa County. Today we regret to announce the first death in Contra Costa County caused by the novel coronavirus, also known as COVID-19. This person passed away at a hospital in our county on Thursday. They were in their 70s and they had a condition that placed them at risk of serious illness, and they had recently traveled outside of the country. Our thoughts are with the family of this patient and all who have lost loved ones during this global pandemic. This death underscores the urgent need for all Contra Costa residents to follow the stay-at-home order, maintain social distancing, and also the state order just issued by Governor Newsom last night. Novel coronavirus is dangerous for older adults and people with certain medical conditions, including heart or lung disease, diabetes, and those with weak immune systems. We believe that by following these orders, we can reduce the spread of the virus right now in our community, and that will save lives. The situation is very serious in Contra Costa. We expect more confirmed cases as our testing expands. So far, Contra Costa Public Health has confirmed 42 cases in our community. We believe that aggressive testing can help, and we are ramping up our testing efforts on a daily basis. More confirmed cases does not mean we are losing ground. It means we are sharpening our focus and gathering data that will help us through this emergency. As always, the best way to protect yourself is to practice good hygiene and social distancing. Because COVID-19 is new, humans have no immunity to it, and there is no vaccine. It's important to wash your hands frequently with soap and water for at least 20 seconds and use hand sanitizer when soap is not available. It's important to cover your coughs and sneezes with tissues or the crook of your elbow. It's important to avoid touching your face. And most important, if you are ill, it is imperative that you stay home. Even if you are an essential worker, it is imperative that you stay home if you are ill. Now I want to turn the microphone over to our Board of Supervisors Chair, Candace Anderson.
Good morning. I'm Candace Anderson, C-A-N-D-A-C-E, Anderson, A-N-D-E-R-S-E-N, Chair of the Board of Contra Costa Supervisors. On behalf of Contra Costa County, I want to express my deepest condolences to the family of the patient and to all who have lost family members during this pandemic. This death underscores the urgent need for all Contra Costa residents to follow the stay-at-home order and practice appropriate social distancing. We want you to think about the older people in your life who have a pre-existing health condition. These are the lives that we're seeking to protect as we follow this order. We recognize that this order is disruptive. It's disruptive to everybody's lives, and we appreciate the fact that Governor Newsom has recognized the importance of this in the statewide order he issued yesterday. We would not ask any of you to do this if we did not think it was important. This is a time for neighbors to look out for neighbors. And if you're feeling discouraged or anxiety or in need of services, we encourage you to dial 211, where we will have people on hand in Contra Costa. We have our helpline there to help anyone who is having concerns, whether it be mental health or other concerns that they need addressed. During this difficult time, we are continuing to provide county services virtually. We have county employees working from home, remotely, in offices, and away from the public who can still assist you. Please go to the county website at contracosta.ca.gov for the most updated information and resources. I want to assure you that Contra Costa is doing all, and I'm going to pause for a minute as our truck backs up. I want to assure you that Contra Costa is doing all it can to slow the spread of the coronavirus and reduce its impact. The county's Emergency Operations Center has been activated and is slowing the spread of the virus and is now the primary focus of our local government actions in Contra Costa. Although we do not know when it will end, we are going to continue to provide you with regular updates. You can visit cchealth.org/coronavirus or call our helpline, which is 1-844-729-8410 if you have any questions about this order and the virus. I feel confident that together as a community, we will come out of this stronger than before. Thank you.
Take questions for Dr. Farnatano and Supervisor Anderson, and then we'll turn it over to Dr. Radhakrishna for Spanish.
To protect the privacy of the family, we're not going into additional details about the individual. This individual did travel from Europe, but we're not going into further details. This person traveled from Europe. We're not going to be more specific, and I don't have the specific date about when they re-entered the country. So the question was, how many tests have been administered here in the county? We are expanding testing on a daily basis. Most testing now is currently being performed by private labs. Private labs are reporting to us their positive tests. We are actually preparing a health order to require negative tests to be reported. At that point, we will have better information about the total number of testing that's going on. Our public health lab is performing between 40 and 100 tests a day, but again, that's a small fraction of the total testing that is being done across the county right now. We think that most people are really taking this to heart and really are trying to follow the guidance of the health order and shelter in place and apply social distance. But we really want to continue to emphasize that so that everyone really does their part to do all they can to maintain social distance and maintain personal hygiene. We have been preparing for this for weeks and looking to identify resources through our supply chains, through our local resources, identifying ventilators that are currently available, and we're also putting requests up through the region and through the state and the feds for those resources, those medical resources, including ventilators. So we're really doing all we can to identify those resources and secure those resources to be prepared for a coming health care surge. We do not. We have enough so far for our current needs, but we want to get more, so we're prepared for a future surge, and so we're still working to get more. We do, unfortunately, anticipate more deaths, as we've seen in other parts of the country and throughout the world. We're at the start of this epidemic here in Contra Costa County. We know the efforts that other countries have put in to do social distancing and sheltering in place take a while to take effect. We also know as we ramp up testing, we're going to identify more cases. So unfortunately, we do expect the numbers of both cases and deaths to go up before they start to go down.
We've seen a lot of parks, a lot of hiking trails actually congested with people because they look at this as a time they can get outside still technically, but then they're not able to abide by social distancing. Do you have anything to kind of reemphasize the importance of social distancing, even if you're not feeling symptoms?
Yeah, we really do want to encourage people to get outside and exercise and enjoy our beautiful natural setting in the East Bay. East Bay regional parks are open, but it's really important to do that in a safe way, and that really maintains that 6 feet of social distancing. So, go out, with your friends, with your family, go on a hike, but stay 6 feet apart, and so do it safely.
Regarding the patient who passed away, what would you like to say about contact tracing, and then just to maybe ease the public's concern about where this person may have been and what you've done to help that?
Our public health department has a very expanded team of staff that does what we call contract tracing. That is any patient, whether they deceased from COVID-19 or just were tested positive, are contacted, identify who are close contacts with those individuals, and we reach out to those close contacts of those individuals to make sure that they are aware that they have been exposed and to isolate themselves and monitor themselves for symptoms.
Probably for Kansas, with regards to going outside, just driving here, I saw a bunch of people on the beginning golf course. Is that an activity that's allowed? Is that recommended?
It's certainly not recommended unless you can really do it from a safe distance. What we're advising people to do is stay 6 feet apart and don't gather together. And so it's up to each city to make a determination with regard to enforcement, whether or not to say you can't golf or not. Clearly, if you're golfing with members of your household and you're staying 6 feet away from everyone else, I think that works. But if you're meeting your buddies and you're all living in different households and you've all been out doing your essential shopping and other things, you have a good chance of spreading the virus if you get together in that close circumstance. We expect people to use good judgment and take this seriously. Kids on playgrounds. We're seeing a lot of cities shutting down playgrounds just because it's really hard to keep children away from one another. It's hard to keep equipment clean enough. And the reality is, even though children are not exhibiting serious effects of this great illness, they can still carry this illness, take it home to their parents, their grandparents, and we really are trying to protect our vulnerable population. So to parents, even though you're healthy and your kids are, let's be smart about this.
As we're expanding our testing, we really want to get to the point where we're able to test everyone who has symptoms. We are trying to prioritize our public health lab, which can do rapid testing, get results within 24 hours or less, to those folks we're most concerned about, those folks who are really sick, those folks who have a lot of underlying health conditions, those folks who may be living in group settings where they have a bigger risk of exposing many other people. But the private labs can test anyone who has symptoms, and we really, the more we test with folks with symptoms, then the more we're going to be able to understand the spread within our community and more able to isolate more effectively those who test positive.
So next week, potentially hundreds of passengers from the Grand Canyon Springs will be released from quarantine at Travis Air Force Base. Being part of the healthcare
So testing for asymptomatic individuals is generally not recommended. It's not really that helpful. If you test negative and don't have symptoms today, it doesn't mean that you're not going to develop symptoms in a few days. And so we really are focusing on testing those with symptoms. So if there are cruise ship passengers that did not submit to testing, but they stayed through their 14-day quarantine, that since they've been quarantined for 14 days, at the end of that, we would not expect them to develop COVID-19 from any exposure they had on the cruise ship. We now know that we have community transmission of this virus, and so the general public is more at risk for picking up this virus in the community than from someone who had traveled in a cruise ship and had completed a quarantine process.
All right, any call for last questions? Then we will turn it over to Dr. Radhakrishna for Spanish. Who needs Spanish? Awesome, okay.
All right. Thank you.
All right, go ahead. Thank you.
Dr. Rohan, R-O-H-A-N, Radhakrishna, R-A-D-H-A-K, R-I-S-H-N-A, Deputy Health Officer, Contra Costa Health Services. Hoy lamentamos en anunciar el primer muerto aquí en el condado de Contra Costa por un residente infectado con el virus coronavirus o COVID-19. Esta persona se murió anoche adentro de uno de nuestros hospitales aquí en el condado. Eran en sus 70s y tenía otra condición crónica. Regresó de Europa recientemente y damos nuestros más sentidos pésames a su familia y a todas las familias que han sufrido la muerte de un familiar por este virus. Esta muerte destaca la urgencia y importancia para todos los residentes aquí en Contra Costa seguir el orden de quedarse en casa. También nuestro gobernador Newsom en California hizo un orden anoche parecido para todo el estado. Este virus es peligroso, más para los ancianos y los con condiciones crónicas como del corazón, pulmón, riñones, diabetes, cáncer y con las defensas bajas. Esperemos que vamos a tener más casos en el futuro, desafortunadamente, y también muertos. Viruses necesitan gente cerca y juntos para seguir propagando. Por eso es tan importante que toda la gente, incluyendo los que no tienen mayor edad y los que no son enfermos, que siguen la orden de quedarse en casa. La situación está crítica y seria en nuestro condado. Tenemos 42 casos hasta hoy y esperemos más cada día. Probar más en los laboratorios públicos y privados va a ayudar a tener más información de la propagación en nuestra comunidad. Esto significa que tenemos más información para batallar contra este enemigo, el pandémico de coronavirus. Reconocemos que este orden es serio y hay pérdidas económicas. No lo hubiéramos pedido si no era esencial para salvar vida. Queremos evitar que mucha gente se enferme al mismo tiempo para preservar la capacidad de nuestras ambulancias, hospitales, salas de aislamiento y ventiladores. Si tiene síntomas de pánico, de sentir nerviosa, de tener preguntas de servicios sociales, puede llamar a 211. Si tiene preguntas sobre el orden de quedarse en casa, tenemos una línea de llamadas 7 días a la semana en inglés y español de 8 a 5 en la tarde. El número es 1-844-729-8410. Todas las ramas del gobierno están trabajando en forma virtual para seguir sirviendo la comunidad. Hay más información en la página web del condado contracosta.ca.gov. También de salud pública y servicios de salud, cchealth.org. Ahora es el momento para solidaridad. Es el momento para el amor y no para el miedo. Ayuden los vecinos y los ancianos. Su sacrificio y cooperación con nuestro orden de quedarse en casa salvará vidas. Gracias.